feel like
ready.
I should be in color guard right now. Alright. This whole bone is the femur. This is the head of the femur. This is the greater trochanter, and this is the lesser trochanter. Trochanters are just giant tubercles. Okay. These are the condyles, so you have a medial condyle here and lateral condyle here, and of course you're going to have the medial and lateral epicondyles up here. Now, on some femur models, you're going to have a blue dot right in here. Just know that that blue dot is the adductor tubercle. Okay. It's an insertion point for, I believe, adductor magnus. You can only see it on like 1 or 2 models, and I couldn't find them. But it was on the exam last semester, so be sure to keep that in mind. Alright, let's get to the lower leg now. This is the tibia. That's the tibial plateau. Tibial plateau is what articulates with the condyles of the femur. This is the fibula. So, tibia, fibula. Keep that in mind. A lot of people tell me that this is the tibula, just to combine the two, and it confuses me a lot because I have no idea what they're talking about. At the end of these bones, you have what a lot of people call mallet heads. Okay, so you have bony protrusions that stick out just like the head of mallets. Mallets are those hammers that judges use in court. So we actually call these malleoluses. So you have a medial and lateral malleolus. Okay. Just keep in mind that the tibia is medial and the fibula is lateral, so that's going to be the lateral malleolus, and this one will be the medial malleolus. Okay. Now, these are tarsals, you have metatarsals, all that fun stuff. All you need to worry about, though, are these 2 bones right here. So there are 2 talus bones, or 2 tarsal bones that you guys need to know. One of them is the talus, which is this one that articulates with the tibia, right there. And then the other one is the calcaneus. Now, you guys should know the name of the tendon that attaches here, which is the Achilles tendon. The reason why it has another name called the calcaneus tendon is because that's where it inserts. Okay, so you guys know the story of Achilles, most likely. Well, the other reason it has a different name is because anatomically it's different. Okay, so any questions about these? Oh, this is a fun little model. I've never seen this before. Oh. Yeah, this is a model we need to go over. I've never seen this model before. That's so cool. Alright. So this muscle here is rectus femoris, which means this is the patella tendon. So this would be the patella. You can see that white right there. And below it would be the patella ligament. Now, on the knees in the cadavers, you will actually be able to see 2 ligaments that cross right here in the middle of the femur and the tibial plateau. These are the anterior and posterior cruciate ligaments, otherwise called ACL and PCL. Well, you have 2 ligaments on the outside supporting this joint. These ligaments are called the collateral ligaments. So you have a medial collateral ligament, which is this one, and a lateral collateral ligament, which is this one. So you have an MCL and a PCL. Now, the reason why you know that this is medial and this is lateral is actually because of all the noise that I'm making right now. Okay. So, you guys can see this femur here and this femur here. This is the medial side, okay? The side that sticks out just a little bit more. So this is going to be the medial side of the femur, okay? Just a comparison, because this is your right femur, sticks out a little bit more, so that's going to be the medial side. This is your left femur, sticks out a little bit more, so it's going to be the medial side. So again, medial collateral ligament, and then lateral collateral ligament. I've actually never seen this model before. What that means is it'll probably be tagged on this exam.